Do you know that stress can cause acidity, diarrhea, bloating, and other sort of gut-related symptoms? Hi everyone, I am Dr. Pankaj Singh, Senior Consultant, Gastropedia Clinic, Noida. Today I will be discussing about stress-related gut symptoms, which in other term is known as gut-brain axis and associated functional GI disorder. Whenever you have stress, you can have gut-related symptoms like all sorts of gut problems like acidity, bloating, burping, and you can have diarrhea, abdominal discomfort, and pain. This is because there is a very close communication between gut and the brain. This is known as gut-brain axis. So, gut-brain axis usually functions by a communication between both gut and the brain with the help of nerve fibers, with the help of release of certain neurohormones, with the help of immune signaling and gut bacteria. And these actually leads to a spectrum of problem in the intestine, which is known as functional gut disorder. Now, functional gut disorder can vary from functional dyspepsia, irritable bowel syndrome, functional bloating, or functional constipation or diarrhea. So this can happen. And we know that gut also have an nervous system which is known as enteric nervous system. This is also called the second brain. And like the brain, the enteric nervous system also releases certain neurohormones, and one of the important neurohormone is serotonin. So whenever there is stress or any sort of problem in the brain, it also affects the enteric nervous system, leading to excess release of serotonin, which causes problem in the gut. So this is known as functional disorder, and it is mostly secondary to the stress or any sort of underlying neurological problems. So how does actually stress affect the gut? Stress affects the gut by altering the gut motility first. It increases gut sensitivity. It changes the gut microbiota. It also decreases the pain threshold. And many times the people think that doctor, is the symptom actually real or it is all in the mind? But the answer to this is that it is actually real. People do have symptoms, and it is just the problem with the communication or the problem in the correct communication between the gut and the brain. So the symptoms can be pain, bloating, gas feeling, fullness, and these all worsens whenever there is episodes of stress. So regarding this, patient needs to be counseled that this is something which can happen, and those who have functional GI disorder, it is often a long standing problem, and they need to be very well addressed about all the problems. They need to be counseled, reassured that this is there, and also patient needs to be explained that for the treatment of this, apart from the gut related medications like you use antacid, you use probiotic, gut specific antibiotics, at the same time you also need to address the stress. And for addressing stress, you may be requiring certain anti-anxiety or stress medicines at the same time. But whenever we start these medicines, many times the people, they get anxious. They're saying that, doctor, I don't have any sort of depression or anxiety, but why are you giving me a stress medicines? But we need to make them understand that this is something which happens in real, and most of the time I make them understand that we give this anti-anxiety tablets or serotonin receptor blocker for a short period of time, and once the symptoms starts getting corrected, I ask them to have a good quality of life, balanced life, a stress-free life, eat healthy, high-fiber food, high-fiber diet, and do some regular exercises, some alternative things like yoga, meditation to be free of stress. And this is how one can tackle with this problem of gut-brain axis related functional GI disorder. Thank you.